In the last 3 weeks, I've had about 6 or 7 patients that are coming in and complaining of knee pain. Now, this knee pain could have started from injury, could have started from a sports injury or a car injury or some sort of an event that they got hurt somewhere, or it could have just came from nowhere. But now during the winter months, they're feeling worse. So some people, some practitioners and some people might say that they're feeling worse during the winter months because maybe it's an arthritic type of pain. Maybe their arthritis is not liking the cold weather. But that's not necessarily the case. What's happening in the winter actually is that we are forgetting to drink water and consume fluids. For some reason, people have this idea that only in the summertime that we're supposed to do that, when we're sweating and we're outside a lot. But actually in the wintertime, also due to the dry temperatures inside our houses, inside our office, because of the heat that's coming out and warming up all the places, it's consuming all the moisture. So your space might not be so does not have the proper humidity, and plus you're not consuming as much water because you feel like maybe you're not thirsty as in the summer months. So what happens is that the stiffness in the joints is coming from improper hydration in the muscles. So the muscles are actually feeling stiff, not the joints themselves. And when the muscles become dehydrated in the winter months, they shorten. They're not relaxing, contracting properly. They're contracting and they're relaxing just halfway. Now what's happening with that, then all of the muscles are getting stiff. Now the joint feels stiff. The joint feels painful because the muscles are tugging on the joint, especially in the knee. The muscles are tugging on the patella. The patella is riding up and down as you extend or flex the knee. Now when the muscles are tight, then this movement is becoming much more rigid. Okay, so what we do actually in my clinic is that we give patients different kinds of injections. Sometimes we give them a cortisone injection after we see their MRI and we see what's going on inside the knee. It could be a meniscal problem, it could be just some effusion, or it could be nothing and they're just feeling a lot of stiffness. Then in that case we give them a natural injection, which is a Tramil injection, which you can find on my website. Actually, this is an injection from homeopathic medication that works really well. We put it in the knee. It improves the circulation of different kinds of fluids in the knee to create the fluid that we need for the knee to work properly, and it brings down the inflammation. Okay guys, so don't forget, the winter time we need to hydrate ourselves and we need to stretch. Stretching and hydration is a key aspect because we are not outside, we're not so mobile, we're not thinking maybe this is an athletic type of time during the year, but we have to pay attention to simple things like hydrating, stretching. But if those things aren't enough, then you guys can come in and we'll examine you, we'll send you for an MRI, and we'll see what else we can do for you. Okay, see you next time.